Hello everyone, in this video I'll talk about the pertussis, which is one of the common communicable disease. Learning objective of this session: at the end of the session you will able to learn about what is pertussis, identify the transmission of pertussis, state the pertussis incubation period, illustrate the stages of clinical features of pertussis, explain the complication of pertussis, describe the treatment of pertussis, and discuss the prevention of pertussis. What is pertussis? It is also called as the whooping cough, which is highly infectious and highly contagious disease, and which mainly affects the children's, and it becomes very fatal if it is occurring to the babies who are less than 1 year of age. And it is caused by Borrelia pertussis, which is one of the gram-negative bacteria, and it affects the lining of the respiratory tract, that is cilia. And this pertussis, when it enters to the respiratory tract, it invades into the respiratory tract. It affects the lining of the respiratory tract, and there it releases a toxin, and which damages the cilia and cause the airway to swell, and which leads to many complications of the respiratory tract. And one of the key symptoms or hallmark sign which we can able to identify in this condition is the whooping cough. A very violent and explosive cough occurs, and that's why in that name it is known as the whooping cough. And it occurs in the late winter and the early spring months. If we look at the incidence in 2016, the WHO reported 1,39,535 cases of pertussis worldwide, with a mortality rate of 4%. In 2018, cases were suggested to be pertussis continue to increase globally, with an estimated of 1,51,074 cases. So how it get transmit? It get transmit through the respiratory secretion, that is called as a droplet infection. When an individual comes in close contact with the infected person, and this discharge from the nose and the throat, which is called as a droplet infection, which is very highly infectious and contagious. But the role of fomites does not constitute a major role in the transmission. So the major role which plays in the transmission of the pertussis is the droplet infection. And the incubation period it means that once the individual is get exposed to the disease, till the presentation of the symptoms, it is known as the incubation period. So that is 7 to 14 days. So here we will see the different stages of pertussis. It is divided into the three main stages. One is the catheteral stage, which lasts for 7 to 10 days. And in this stage, the most of the symptom which we can able to see is get unidentified, which is very unrelated to pertussis, because it is very common to other conditions also, like cough, which occurs very severe and mostly frequent at night, and cold, running nose, and conjunctivitis. So these are the very common symptoms which often are unidentified as a pertussis in the initial stages. But in the second stage, which is called as a paroxysmal stage, which lasts for 2 to 4 weeks, and in this phase or in this stage the coughing occur more vigorous, it is uncontrollable, and a violent coughing and excessive coughing and explosive coughing occurs. So that is the key and hallmark symptoms and signs of this disease, the whooping cough. The child a bout of cough terminate with a long drawn of inspiration, and that produces sound that is known as the woof, or crowning sound that is known as the woofing cough. And this woofing sound is produced when the inspired air is rushes to the half open glottis, and because of that this sound is comes out, and that's why it is known as the woofing cough. Because of this explosive and because of so much of violent cough the child appears to be choked. And there's also episodes of apnea, or the child sometimes cannot able to breathe also, and child it is this coughing, violent coughing makes very hard to breathe also. And because of all this coughing and choking, the child looks so anxious, suffers face, and this bout of cough ends with the vomiting. And after the bout of cough, the child appears very listlessness, dazed, and sweat profusely. On convulsion stage, it lasts for 2 to 4 weeks or the longer. It depends upon how early the treatment gets started. So episode of cough become less severe, and the interval between this explosive manner of cough or the paroxysmal coughing start to get increasing, and child getting better, the general condition appetite also get improves. But in the condition like if the child is in malnourished state, so in this case the progression is quite delayed. So this is about the stages of clinical features. Let's look about the complications, as it mainly affects the respiratory tract like the trachea and the bronchi. So it mainly create a complications of the respiratory tract. So it leads to a pneumonia, it leads to bronchiectasis, it causes subcutaneous emphysema, it affects as a pneumothorax. Tuberculosis also when get exposed, and conversions which also complications which leads to many complications because of the hypoxic conditions, and which leads to many neurological conditions, like it can lead to hemiplegia, paraplegia, it can lead to aphasia and blindness and deafness also, hernia and rectal prolapse, subconjunctival and scleral hemorrhage can also occur because of the strain which affects into this area because of the explosive cough, petechiae, epistaxis, and intracranial and retinal hemorrhage may also occur. So these are the list of various complications which affects mainly the respiratory tract infection. Next is that how it can be managed. So obviously these children who are having a whooping cough, excessive of whooping cough, need to be get hospitalized, and immediately they need to be start antibiotic, and a mild administration of sedation has to be also administered to just allay the anxiety. And in the antibiotic therapy, it must be started at very early stage just to reduce the prolong or the course of illness. So erythromycin 40 to 50 mg per kg per day orally for 14 days. Erythromycin, azithromycin, that is 10 to 12 mg per kg orally for 5 days, and salbutamol, that is known as albuterol nebulization to control the bouts of cough. This nebulization helps to very soothe the respiratory tract with humidifications, and along with that the nutritious diet, that is high protein and caloric diet, has to be given. But most important point that need to be keep in mind that cough suppressants and antihistamics should not be administered to the child which is suffering from the pertussis. Next, we will see about the prevention. If a individual is been exposed with very close contact who is having the pertussis, what can be done? So first of all, a person who is being exposed to someone who is being affected with the pertussis, so we need to do a isolation of that person. That is respiratory isolation is very much important. Respiratory isolation, it means a proper covering of the face with using of masking, and the person who is visiting and doing care of the individual child or individual person need to be also proper masking and need to be take a proper precautionary method. And this respiratory isolation for the 5 days, if the antibiotics, that is erythromycin, has started. If the antibiotic has not started, so isolation for the exposed person or individual need to be do for the 3 weeks if it is not treated with the antibiotic. Along with that, the care of contacts should be also done. the 2 weeks of isolation, exposed individual after termination of contact, and the chemoprophylaxis need to be also get started, like athromycin 40 mg per kg per day orally for 3 to 4 divided doses in 2 weeks, and alternatory cotrimazole can be also used. So this is the isolation of the patient and the care of contacts. Yeah, it is a vaccine preventable disease, and already vaccines are available, and it is under the universal immunization program. In the schedule already it is there as a name DPT, and nowadays pentavalent, it is mixed with pentavalent combination. So 3 doses of DPT, 4 weeks interval, or the pentavalent, that at the 6, 10, and 14 weeks. Along with that, the booster doses need to be administered at 15 to 18 months and 4 to 5 years. So 2 booster doses and 3 shots at 6, 10, and 14 weeks. Comes with the end of the topic. Pertussis. Hope you understood about the different stages and the concepts regarding the pertussis. Thank you.